Hi everyone, welcome back to my YouTube channel and today we are going to talk about anterior triangle of neck. So let's start topic with introduction. Anterior triangle of neck is a key anatomical region that is located at the front of the neck. It contains major neurovascular structures, glands and lymph nodes, making it crucial for clinical and surgical anatomy. It is subdivided into smaller triangles that help in locating and studying important anatomical structures. Boundaries of anterior triangle. It has anterior boundary that is by the midline of neck from chin to mandibular sterni. It has posterior boundary that is formed by anterior border of sternocleidomastoid muscle. It has superior boundary that is formed by inferior border of mandible. It has apex at the jugular notch of the sternum. It has roof that is by skin, superficial fascia, platysma and investing layer of deep cervical fascia. It has floor that is structures that are covered by pretracheal fascia that include pharynx, larynx and thyroid gland. Subdivision of anterior triangle. The anterior triangle is divided into four smaller triangles by the digastric muscle and omohyoid muscle. It is divided into submental triangle, submandibular triangle that is also called as digastric triangle, carotid triangle and muscular triangle. First is submental triangle. Its boundaries are lateral boundary is anterior belly of digastric muscle. Inferior boundary is by the body of hyoid bone and its floor is by the mylohyoid muscle. Contents of submental triangles include submental lymph nodes, small veins forming the anterior jugular vein. Next subdivision of anterior triangle is submandibular triangle. It is also called as digastric triangle. Its superior boundary is by the lower border of the mandible. Its inferior boundary is by the both bellies of digastric muscle. Its floor is by mylohyoid, hypoglossal and middle pharyngeal constrictor muscle. The contents of submandibular triangle include submandibular gland and lymph nodes, facial artery and vein, hypoglossal nerve and parts of submandibular duct. Third subdivision of anterior triangle is carotid triangle. Its superior boundary is by the posterior belly of digastric muscle. Its inferior boundary is by the superior belly of omohyoid muscle. Its posterior boundary is by the anterior border of sternocleidomastoid muscle. The contents of carotid triangle include carotid sheath, for example, that include common carotid artery, internal jugular vein, and vagus nerve. Second content is hypoglossal nerve, that is 12th cranial nerve and ansa cervicalis. Third content is deep cervical lymph nodes, and fourth is external carotid artery branches. Fourth triangle is a muscular triangle. Its superior anterior boundary is by the midline of neck. Its superior boundary is by superior belly of omohyoid muscle, and its posterior boundary is by anterior border of sternocleidomastoid muscle. Its content include infrahyoid muscles that are also called as strap muscles that include sternohyoid muscle, sternothyroid muscle, thyrohyoid muscle, and omohyoid muscle. Second content is thyroid and parathyroid gland, and third is larynx, trachea, and esophagus. Contents of anterior triangle include glands that include submandibular gland, thyroid gland, and parathyroid gland. The contents include arteries, for example, common carotid artery, internal carotid, and external carotid artery, and its branches that include facial artery, lingual artery, and superior thyroid artery. Third content is veins that include internal jugular vein and its tributaries. Fourth content of anterior triangle is nerve that include vagus nerve, that is 10th cranial nerve, hypoglossal nerve, that is 12th cranial nerve, and glossopharyngeal nerve, that is 11th cranial nerve. And also there are branches of cervical plexus and sympathetic trunk. Fifth content of anterior triangle is lymph node that includes submental lymph node, submandibular lymph node, and deep cervical lymph nodes. Sixth content of anterior triangle is viscera that include larynx, pharynx, trachea, and esophagus. Clinical significance of anterior triangle. First is surgical access, as there are carotid artery ligation, thyroidectomy, and lymph node biopsies are performed in the anterior triangle. Second significance is lymph node examination, as lymph nodes are divided into levels for staging head and neck cancer. So they are examined for the cancer staging. Third significance is neck masses, as most congenital and acquired neck swelling appear here, like thyroglossal cyst and lymphadenitis. Fourth significance is vascular procedures, as carotid pulse palpation and catheter insertion are done in the carotid triangle. Conclusion of this lecture video. Anterior triangle of neck is a clinically significant area because it contains essential vascular, neural, lymphatics, and glandular structures. A subdivision helps in anatomical localization and are key landmark in head and neck surgery, oncology, and radiology. And this was all about anterior triangle of neck. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.